Go, we're live.
Good to go?
We are.
Good.
Yes, we are.
Okay, we're calling to order the City Council Successor Agency Housing Financing Power California Choice Energy Authority meeting. This meeting is being conducted telephonically, virtually, pursuant to Governor's Order N2920. Because this is a telephonic meeting, all votes will be taken by roll call. City Clerk, please call the roll.
City Council Member, Agency Director, Authority Member Doris.
Present.
Molly.
Present.
Mann.
Present.
Vice Mayor, Vice Chairman Chris.
Present.
Mayor Chairman Paris.
Present, thank you.
We have a quorum.
Wait a minute. What did you say?
You know, you're very observant. That's the first time in 12 years I said present instead of just to appear different. But
Well,
you know,
congratulations.
it took me 12 years to want to join you folks. Okay. Do we have someone to do the invocation? Daryl, Doris, would you please do the invocation?
Father, we thank you right now. We ask for your wisdom and your guidance. God, we ask right now that you continue to lead us in this time of COVID, in these times of making decisions. You said that if any man lack wisdom, let him pray for it and ask for it. So we ask right now, God, that you lead and guide us on how to lead this great city. We thank you right now for all things work together for the good. In Jesus' name we pray. Amen.
Amen. Thank you.
Amen.
Any matters to be removed, City Manager?
No, sir.
Thank you. New business item 1. We have agendized a vote of no confidence in the Los Angeles Public Health Department Director, Barbara Ferrer. And we have a staff report from Jason Cottle.
Yes, sir. The agenda to before you today is a request from the council to have this conversation. Obviously, we've seen what's been going on with the COVID cases and the challenges we're facing as it relates to COVID, and more importantly, I guess as it relates to the no confidence vote, is the shutting of the restaurants specifically. If you compare what the state has done as it relates to regulating COVID and then the additional changes the county has made, they seem to be minor changes at best that are not based on science, and they seem to have a balanced impact on restaurants specifically. I think we've heard from a number of our restaurants, and you guys have been party to meetings with them and public meetings with them. They're obviously concerned not only about their well-being, their health, but also the well-being and mental health of their customers. So I think there's an opportunity for you to voice your concerns to the public health department. And there's a number of ways to do that. And under your direction, I place this as one of those options.
Thank you. We have with us today our COVID team, Dr. Larry Stocks, Dr. Jonathan Strong, and Tiffany Tanner. Do you have anything you guys want to add?
I have a few slides to update in terms of setting a place to talk about, and I have also some updates on the vaccine, if it's okay to present.
Yeah, we might as well do it now, and then before we go to the vote. So go ahead.
Can everyone see the screen?
Yes, sir.
Okay, good. Okay, I'm going to go full screen. All right, so this is the situation. Start with the United States having basically Texas having the most new cases. Florida, Illinois, California ranks 4th in terms of cases, new cases. If you look at the map to the right, the darker the color, the higher the reported cases per 100,000. California looks a little lighter, but cumulatively, we have a lot of cases. This slide shows in terms of new reported cases by day. As you can see, since Thanksgiving and on, it's been substantially higher than the July, August, and the initial April, May spike. And same thing with the death. Death was high in April. It improved in July as we learned how to take care of patients better. But now death is continuing to rise with this most recent spikes. This looks at California in particular, and of the 58 counties, 52 are in the widespread mode. As you can see from just the coloring, the deep purple is virtually everywhere in the entire state. We are averaging at 30 new COVID positive cases with a positivity test rate of 6.4%. About last month, we were at 3%. We basically doubled in terms of positivity. This was LA County level data through the 30th. This was on their website yesterday. 7,500 cases new and 408,000 total. As you can see, testing continues to increase, and positivity testing increased now to a 7% rate. And then we talk about hospitalization. As you can see, it's peaked again. And last time when I spoke, death rate was really not there, but now it has gone up significantly. And when you look at the death rate, mortality rate in particular per 100,000, Hispanic Latino community seems to have the highest number, and the poverty, high poverty areas, also the highest burden, those in the 30 to 100% poverty area. This tells us who is still getting sick. It's still the young. Between 18 to 49 is the majority of the those that are reporting positively infected. There's a spike at 50 to 64, but for the most part, it's basically before 50. Now this slide tells us, tracks the light blue is the positive cases over, so this is a July, and here are the positive cases most currently. So you can see the spike now is a lot higher than the spike in July. And the dark blue is the death rate, and death usually lags behind the spikes. And here the death rate was this high sometime later. The concern is that because the spike is so high, the death rate will also be just as high once because it follows it. This is a map of LA County. This is us here in the Antelope Valley. We are in the 36 to 95 death per 100,000 rates. There are pockets, for example, this is dark blue here. This area is the city of industry. I believe Hacienda Heights is there as well. There's a sliver of it, but for the most part, we are better off than San Fernando Valley. We're worse off than Santa Clarita. So we're right here, pretty much most of the, compared to most of LA County. This is numbers of hospitalization. As you can see, this is all of California. It spikes up, and basically confirmed cases in the ICU. So we're getting better compared to, say, in April in terms of caring for patients. We don't intubate them as quickly. Hence, they survive longer. We have more tools now with remdesivir, dexamethasone, and various other medications. So the ICU rates are trending down, but it may creep up again. And these are numbers from yesterday. I didn't get to update the numbers from today, but yesterday we had 68 confirmed at AV, 45 at Palmdale, and basically it's double of what happened last month. And the ICU numbers, usually 1 out of 4 or 1 out of 3 patients end up in the ICU at both hospitals. This is us here in the Antelope Valley. we compare ourselves to LA County. The adjusted case rate for 100,000 for LA County is 39.38. Here in Lancaster, we have a younger demographic, so our numbers are higher in terms of a case rate. In terms of death rate, we're better off. Here, LA County, it's at 70. We are at 57 per 100,000. So our death rate's better, but our adjusted case rates are higher, and that's Lancaster. Here, this is Palmdale. Palmdale's case rate is significantly higher, and their death rate is also higher, but almost close to the 70 in LA County. So our neighbors to the south are struggling a little bit more than we are in Lancaster. So I could pause now. I can just go directly to a few slides regarding the vaccine, because that's the latest in the literature, in the news of what we're going to get. So the new vaccines, there's 3 of them. And
before you go to the vaccine, I do want to cover what you just covered.
Okay, sure. I'll pause.
I'm a little confused about the metrics. So let me just ask you some hypotheticals. If a testing station is not testing non-symptomatic patients, does that change what our rates look like?
So you're talking about the denominator?
I'm sorry.
You're talking about if you're not testing people, your denominator will be low. So if you have sick patients, then your rates will be higher. Does that answer, or is that the question you're asking?
Yes, and are all of the testing stations now testing both symptomatic and non-symptomatic people?
Yes. The law requires us to test anybody who asks for it. So people who are asymptomatic who have to travel, who are going to go to a party for Thanksgiving, they were asked to be tested. And if they're asymptomatic, they become part of the denominator. So if you test a lot of people who are asymptomatic, your rates will go down. But if you don't have testing stations to test them and you're only testing the positives, then your rates will go up. Your positive rates goes up.
So who all is doing the testing, and are all of those results reported to LA County Public Health?
So it would be maps to the zip code. So the testing would be, say, Kaiser, High Desert, Palmdale Regional, Antelope Valley Hospital, and then various other private clinics. Also, LA County, I think on, the LA County facility.
Now, LA County has recently opened some test facilities in Lancaster. Before that, they were not there. What impact would that have?
Hard to say. If we're only testing asymptomatics at those sites, in other words, more people are asking to be tested and they're negative, then if we have more negative in the denominator, our positivity rate will be lower. But if only the sick people come to ask to be tested and they are positive, then of course the positive rates will be higher. So it skews it somewhat.
So they're extrapolating those numbers and then applying it to the 100,000 people?
Correct.
It occurs to me that's a pretty inaccurate way to determine what the CFR is, isn't it?
It's the standard. So if you have a large number, like throughout the county, 8 million people, the error is less. If you have only 100 people that you're testing, the error will be higher. So the larger the testing sampling population, the more precise the testing result. So
are they using an algorithm that adjusts for that, or are they just doing are they not adjusting at all?
They adjust for population, but they also adjust for age as well. So especially with the death rates, you have to adjust for age, because if you have in the older population, your death rates will be higher. So they can't just say this is the death rate. They actually adjust for age as well. So.
Since this epidemic started, I've done a lot of reading about epidemics and about COVID particularly. And my understanding has grown that the only number we should really be concerned about is what's it called? The fatality rate based upon actual people that have COVID. What's that called? The case fatality rate.
Case fatality rate.
Am I correct in that?
You can slice data in so many ways. For example, the case fatality rate for the whole world is 3%. For the United States, it's 2.8%. If you compare case fatality of COVID versus, say, influenza case fatality is a little bit over 1%, 1.1, 1.2. So if you look at that alone, you can see that COVID is about twice as lethal as influenza, twice as contagious, for example. So yeah, you can slice it in many ways.
Well, the problem I'm having with the public health numbers is the metrics don't give us enough information to make adjustments. I mean, if we have a low fatality rate based upon the case fatality rate, if it's low, then we know we're doing stuff right in the hospital.
Right.
And we know that we're doing stuff right in the doctor's office, right? But they're not giving us those numbers, and I'm wondering why they don't.
Well, sometimes not having the detailed number down to the local area, you end up making policies that's one size fits all. So you basically close everything down, even when this community is doing well or the other community is doing poorly. That's the problem with one size fits all numbers. So.
Okay, good. Anybody else have any questions?
Yeah. Do you find, is there any truth to that there's patient dumping at AB Hospital?
I think I haven't seen it, but maybe Dr. Stock can also chime in. I haven't seen the patient dumping.
Yeah, I don't see that. I think most of the people who live up here are the ones coming here. And our numbers went from 41 COVIDs in the hospital to 75 in about a week. So the prevalence has jumped. There was some behavior that went on from between Halloween and Thanksgiving that led to increased transmission, now resulting in increased hospitalization. And I think some has to do with the weather, gatherings, and other sort of things. But we are now, together with the rest of California and the rest of the country, at some risk of overwhelming normal hospital capacity. And the hospital, I don't know what's going on at Palmdale, but at AV, we have deployed our surge plan. We're opening up new units for patients to expand our capacity. And if you drive by the ER, you'll see some new tents out front of the ER because we're trying to adjust ourselves so we can continue functioning as an ER. Because the ERs at times are holding, up to 40 patients in our 50-bed ER, waiting to go upstairs and be admitted. So we need more space. So we're in a serious surge right now.
Okay, well, let me ask you more specific questions about that. Could we go back to the last slide?
This one? Hospital slide?
Yeah, this one right here.
Okay, let me go forward.
Yeah.
Okay, this is yesterday's data, so.
Okay, so this is this is incongruent to me. You have Palmdale with more infections than we have, considerably more. But Palmdale Regional only has 45 confirmed COVID cases and only 14 in the ICU. That makes zero sense to me. And what I've also heard, and I totally recognize, you guys, how uncomfortable this is. I totally get it. But what I've been told by others at the hospital is that Palmdale Regional, if the patient is uninsured, is claiming they don't have facilities to treat them and transferring them to AV. Is there any evidence of that?
I'm not aware of that, at this time, but, either way, I know that it's a smaller hospital there and they have fewer capabilities. They do have ICU. They have fewer beds overall. I don't know what they're doing in response to COVID. I know what we're doing. We're ramping up, and I know that we have more services. So I'd have to talk to someone who's actually at Palmdale working there.
I work at Palmdale. I also oversee their infection control. We are struggling there with testing. People are waiting 2 days to get the test results, and so things are stacking up. The ED is generally full, and actually doctors and nurses in the ED are getting COVID. So they're also down, and then in the laboratory as well. So they are down in personnel as well. I'm not sure. I haven't heard about pushing non-insured patients to AV, but it may happen. We just don't know. I haven't seen a memo or anything like that says that this is what we do. So.
Okay, I just want to be clear. We're walking into a situation that, from what you've been telling me, that it is probable that we are going to run out of beds at AV Hospital. That means we're very quickly going to be in a triage situation of some kind, meaning who has to go to the fairgrounds or something like that.
So what I'd say is the hospital's deploying their surge plan, and that plan is to accommodate as the demand increases, to increase the capacity. So we've gone up from, this 199 is our main building plus another 50 patients in the WIP. We're now just went up to, so that'd be 250 beds we normally operate. We're up to 290 beds today, and we can continue going up. So there are plans to adapt. And I think, we're also changing, we're into a crisis level of care as well. So when you're in a disaster situation, things are different. The standard of care is different. And again, that's happening on a national level. The fairgrounds are going to be an important resource, and we're having some discussions about how we can work together on that. One proposal we put out there was the idea of taking patients perhaps that were ready to go home but weren't ready, didn't have a place to go immediately, and to move them from their hospital bed, take them to the fairgrounds where they could get picked up by their family. So they'd be there for a part of a day or 1 day, or waiting to go to a nursing home. So to act as a discharge zone as a first step. So we're studying that right now to see how helpful that might be. So I do think there's room to pull in resources of the things we planned in the springtime.
So I want to add, the average length of stay for COVID is 8 days. For a lot of us, by the 5th day, they're ready to go. But you can't send them home with the high level of oxygen that they need, the 5 liters or 10 liters, because most home durable medical equipment cannot give that level. So if there's a place for them to go to recuperate, and give them the 10 liters, 7 liters of oxygen, then that's a perfect place. And so right now, for example, as I mentioned, we have patients who are day 7, day 8. They're just hanging around waiting to improve on their oxygen. And I think that's the ideal place for a transition to the fairgrounds. That'll really help.
One of the limitations, Mayor and Council, is nursing personnel. So that is, we may be able to add space and as the patients go up, but so that's another discussion. I know we had a number of nurses that were willing to volunteer in the springtime. Again, people are in a different place in their life than they were in the spring. Many people have gotten sick. Many people, their life circumstances have changed. So all these things have to be taken into account, and what the needs of the hospital is. But I appreciate this is a dynamic situation right now.
While we're talking about the surge capacity and the approaching of a crisis situation, have we heard anything about what our EMS is dealing with? Are they being overwhelmed? Are they still holding strong? Does anybody know?
Honestly, I've been pretty much hospital-based, and I think Dr. Stark would be the front of the hospital, so you would hear more. I haven't heard.
Yeah, I'm speaking on my own perspective as an ER doc. The hospital. Again, I can't speak for the hospital or EMS, but my perspective is that the EMS agency has had a long-term, issue with wall time, meaning the inability to immediately drop off patients when the ERs are full and unload, and that isn't getting any easier in the middle of the pandemic or in this surge. We're redoubling our efforts and focusing on that at AV Hospital to help the EMS, LA County in particular, and also Kern County ambulances to offload, very quickly and to get back out to take the next run. So, but it is a challenge. I can tell you when you have no room left, and you have a sick patient, you're struggling to find a safe place. So normally we'd put them into a room, but we also have to take into account COVID. So there's only so many places you could put a patient and maintain infection control, especially if you have to manage someone's airway. There's only a couple places we can do those kind of resuscitations. So it's you're constantly moving patients and trying to keep everyone safe. So it's a real challenge.
Thanks.
What's the projections?
What's that, sir?
What is the projections as far as when we run out of beds?
I don't know the answer to that, but it depends on both capacity and throughput. How long do people stay? How quickly can you get them out? Meaning, can you get them home? Can you get them to a nursing home? Can you get them to an alternative setting like the fairgrounds? And also, what's your baseline capacity? Again, that depends. And we're sorting through that right now. And I can tell you, it's all hands on deck right now. So I don't think we have a number, but I don't think we're going to peak out. I don't think we peaked out yet. Those graphs that Jonathan show it's going to be a couple weeks before we reach hospitalization rates that that double hump picture. I don't know, Jonathan, can you go back?
Yeah.
See that right there? Yeah. So there's the daily cases and then the daily deaths. So you saw that the cases are going up, the deaths haven't gone up. So these cases, and again, from the graphs that we've seen, I think our numbers may still be escalating. So we'll we don't know yet. So we're trying to stay ahead of the demand, and that's why we just erected 3 tents at the ER, and so we can continue having those function, and the hospital's working on their end. So we're working on the front end, they're working on the back end.
What we're seeing now is the effect of Halloween, the get-togethers on Halloween, and then we haven't seen the get-together effects from Thanksgiving yet, and then after that the Christmas, New Year's. So it's going to go until February, end of January, February at the least. That's what we're predicting, because you get infected, and it takes you about 5 to 10 days to fully develop the disease. And so we're seeing and then you get another 5 days or so until you go see your doctor or go to the emergency room.
Do we have sufficient antibodies?
So
no.
The antibody, so we have 2 different types of antibody systems, and we just got a starter kit from Eli Lilly, and then we also got a starter kit from Regeneron. So we've treated about a dozen patients now with the Eli Lilly antibodies. It's gone very well, and we're supposed to continue to get replacements as that goes on. So that we're ramping that program up.
Okay. All right. So, for weeks now, we've been hearing, you and I have had discussions, the whole team has had discussions that, the CDC, Fauci, all of them said that if everybody wore their masks, we'd be okay. Has that changed?
No, that has not. We still have the same recommendations. It's just that people are not people are fatigued from following those recommendations because masks do help. Studies after study after study have shown that wearing a mask, avoiding doing the 6 feet distance, do reduce infections. It's just people are not doing it. My daughter just came back from college for Thanksgiving, and she says she thinks everyone in the dorm has COVID, but they won't tell their RA because they're going to be prevented from attending group meetings or parties, and so people are not following recommendations. So that's new. And for the most part, infections are coming from families now. It isn't from a restaurant or a hospital or a cafeteria. It's actually families reporting that. And Dr. Stark will agree. Every time I interview a COVID patient, how do you think you got it? I got it from a family gathering, and 3 of my kids also got it. All of us are infected in the family. It's just I'm the one that's sick. So
that's exactly. I've heard that story so many times, yes. And it's unfortunately it's people you feel you trust. Of course, you do trust them, but you have the mistaken feeling because I trust them, they can't possibly infect me, but they can. They don't want to. They don't know they have it, but they find out a day later that they have it, and then you find out a couple of days later that you have it. And so it's exactly what Jonathan said is it's keeping your guard up at all times. Which is hard for people, especially during the holiday season. If people did keep their mouths out, if they did avoid gatherings, if they did wash their hands and keep their distance, I don't believe we'd have the numbers that we have right now.
Okay, thank you. All right, let's go on. Anybody else? Anybody have anything to add?
The last thing I'd say, Mayor, is that we're so close to getting this vaccine. There is light at the end of the tunnel here. It's not like it's an indefinite period of time. We know the vaccine is coming, and we know we're going to start very soon. There's a staged rollout for this thing. There'll be enough for everyone in the country who wants to be vaccinated, and that is going to be a game changer.
Okay. Do we have a breakdown yet from how this is going to be distributed in the Antelope Valley?
No, I've heard that Governor Newsom will be receiving 371,000 doses, and that goes to the first 1A group, which are healthcare and those in the nursing home. They're not going to distribute it similar to remdesivir or bamlanivimab. They're going to distribute it. I haven't seen the actual plan to distribute it, but it's going to come from the state rather than the county level.
I have a question, if I can ask. You just mentioned the nursing homes. I'm actually dealing with a death right now in my ministry. The doctor refuses to sign the death certificate because he's leery of how he was taken care of in the home. Are you guys having high reports about how people are catching COVID or sickness rates or death rates rising in the nursing homes within the Antelope Valley? Because I'm curious about how we can, as a council, even check into that. I'm just curious about those numbers because it's driving the family I'm dealing with right now really to their edge because nobody will sign a death certificate simply because they're leery of the care that was given to him. And it's one of the nursing homes right down the street from Antelope Valley, so hospital.
There was an outbreak in July, a huge outbreak, and the nursing homes had to close down, and we were testing nursing home staff on a rotational basis on a monthly basis. And then there's been intermittent shutdown to the nursing homes when the COVID numbers are high and they can't, they are trying to avoid intermingle. So throughout the country, though, death in a nursing home is high, the highest of all the demographics. So I'm not surprised if you have that problem.
So,
Yeah,
so what is-
we just recently, Daryl, too, as it looks for the spike, we kind of check. Department of Public Health has a really good, like a dashboard that kind of tracks that. And we circled back with Department of Public Health, asking them about their regular inspections. They do have regular inspections. They have regular nursing. They have regular training, and they have a good dashboard. And we didn't see a spike. There's obviously cases, but nothing that was alarming that we could tell.
Okay.
Now, as that means to the amount of care they were getting at that site, I can't attest to that. I don't know.
I have to say the nursing homes have gotten very good at testing, because we test our staff there as well, and we also treat our staff that are positive, and they've been pretty thorough ever since that last outbreak back in July. Just a few more slides if you want. Basically, the new vaccine is very novel. If you compare it to, say, the flu vaccine, you take the flu virus, you inject into the egg, you allow the flu virus to multiply, then you isolate the virus, and then you isolate the protein from the virus, and then you make the vaccine. That takes about 4 months to do. This one here, you just inject the spike protein, which is coded the mRNA, and it goes in, and then your body, within 2 to 3 weeks, makes the antibody, and basically floats in the bloodstream, so that when you see a SARS coronavirus, it binds and destroys the virus. So it's very novel, and it's very rapid, and that's why it's able to go to the market so quickly. And this is just the science behind it, but basically, the mRNA is converted into the protein inside the body, and the antibodies are made. So here's a problem with it. It's very unstable, because it's an mRNA molecule. It gets destroyed once it's injected into the body. So you have to keep it really, really cold, super cold, in fact. For example, the Pfizer vaccine has to be in -70, which is dry ice cold level. So here are the three vaccines. 2 are going to be approved any day now, which is the Pfizer biotech vaccine and the Moderna vaccine. AstraZeneca is about to be, they're finishing up their studies, but the bottom line is 43,000, 30,000 cases studied. Some are global and some are medically high risk. The Pfizer vaccine is the 2 doses, day 1 and day 21. And the Moderna is 2 doses, 28 days apart. Now, efficacy is amazing, at least from the 40 to 30,000 cases that they looked at. It's at 95% and a 94% efficacy. You know, you compare it to the flu vaccine. The flu vaccine has a 50, maybe 60% efficacy. This one is amazing. In fact, the best vaccine in the history is the hepatitis A vaccine, has a 90% efficacy. And this one just basically 94, 95%. So far from the data there's no significant safety concerns, but to be honest, most serious side effects from vaccines come out, it's in the 10 million range. So in other words, serious side effects come 1 every 10 million. Here we've only had about 70,000 cases. So as it rolls out, there may be more safety concerns. Pfizer is going to make 50 million doses by the end of this year, and similarly to Moderna, and about 1 billion doses by next year. And they've already submitted to the FDA, as I mentioned, -70, -80 for Pfizer. Once you dethaw it, you take it out of the freezer, you only have 5 days to give it. Here you have 30 days to give it for the Moderna. And the cost is about $20 to $37. The AstraZeneca looks really good, but the efficacy is only 70%. But it's really cheap. It's only $2.50, and you can store it in regular refrigerator, and it lasts for 6 months. So this is probably what's going to go on now. But I think as soon as AstraZeneca finishes, this will probably be more available for the rest of the world. The Advisory Committee on Immune Practices, called the ACIP, they're the ones that are basically putting out the guidelines for who's getting the vaccine. And initially in November, they published this, they recommended that healthcare personnel gets it first, followed by essential workers, about 87 million, followed by high-risk patients, those with hypertension, obesity, and diabetes, and then followed by those over age 65, including the ones in the nursing home, and then after that, the general public. And these are the essential critical infrastructure workers that they've identified. This is kind of the Homeland Security identification. And then yesterday, they basically moved 3 million people, those with long-term care, into the first group, simply because this is the group that has the highest mortality if they get infected. Those with high-risk conditions, obesity, diabetes, and cardiovascular disease, basically 90% of people admitted to the hospital have one of these conditions. And for those over age 65, 80% of deaths were among those over age 65. So that's why they moved the nursing home population to the first group. So phase 1A is the healthcare and long-term care facility residents. Phase 1B are the essential workers. Phase 1C are the adults with high risk, adults over age 65, and then phase 2, 3, and 4 are the rest of the population. It's believed that we will get to the general public around April of next year. So here's the various timelines. So the FDA is expected to approve this week, maybe next week. Then phase 1 will roll out, 1A will roll out mid-December. We'll immunize the healthcare workers, 21 million, and immunize the long-term facilities, 3 million. And then 1B, the essential workers. 1C, the rest of the people on the chart that I mentioned. And that's all I have for formal presentation. I will stop sharing.
Thank you. Any questions?
No, but I did want to make a comment regarding the testing. Back to how you were asking, Mayor, about the number of tests and how Dr. Trong made it clear again that the more testing that we have, as long as we have a decent number of negative test results, our percentage will improve. More than that, too, I strongly feel, and this is backed up by lots of evidence, the more testing we do, the better, obviously, an idea we have as to how well we are controlling the spread. And so increasing the number and the availability and the speed with which testing is available, I think is imperative at this point. I personally don't see patients in the hospital, but I see patients through an urgent care and through appointments, family practice. And as is true with the influenza every year, people are still fighting, quarantining, staying at home, isolating, even from their family in their house once they're positive. And people are occasionally not wanting to get tested because they're afraid that if they get tested and then go to the market or something of that nature, that something's going to happen. They're going to get a ticket or they're going to get arrested. And I feel like we need to make it very, very clear that everybody getting tested as often as they feel is necessary for them based on their exposures just in the public is only going to help us control this more accurately and quickly, and not, I don't believe at least, lead to anybody getting arrested or fined or anything like that.
As much as I would like to, I understand that it's counterproductive. I mean, I honestly think that anybody who has COVID and goes out in public ought to be shot, but because they're killing people. I mean, we know now, there isn't any secret about this. But at the same time, I recognize that we will save more people by just ignoring that idiocy than acting on it. But I don't know what is the best way to get that information out that nobody's going to enforce anything if you test positive. You know, I don't know how to do that, but I think that we should probably do. You know how hard it is to run all this from home. I want to pull my hair out. I haven't left this chair in 12 hours, it feels like. Anyway, that being said, I think that city communication staff ought to do some research and find out what is the best messaging we can do. What I don't want to do is just do something, because I think that's why we're here tonight, is we're dealing with people in government who just did something without any research to support it. So Jason, can you give me some idea of how long it would take to get a program in place to get that messaging out on emails and things like that?
Yeah, we can do it immediately. We'll get working on it tomorrow.
Okay, good, thank you. Does that seem to satisfy it, Tiffany? All right, good.
That'll be really helpful. Then I won't have to have the conversation 14 times a day.
All right, good. And I think it ought to be a repetitive message. And maybe we ought to put something on the audio tape that we have on the boulevard and places like that. I mean, it's a good point. What we want now is to reduce the load in the hospital. However, when we talk about masks, I have a different view of that entirely. I thought it was going to be on the agenda today that we make it a misdemeanor to be any violation of the distancing and mask requirements would be a misdemeanor, and we want the department to enforce it. At this point, I don't think there's any excuse. But let me read you what I got today. This is the idiocy that's happening. This message is for Rex Paris. I saw your comments on masks. People like you disgust me. You are the terrorist, not us. If the masks actually worked, the virus cases would be going down. I am responsible for my health, not you. This is about control, not safety. You can take the mask and stick it up your ass. I have not worn one, will never wear one, and will remain healthy by practicing good hygiene. How did you hear about us? Oh no, that was our response to him. His name's Cecil. Let me see if I can find it. Cecil, you're really lucky because I didn't copy that part of the email. But that is the kind of ignorance we're dealing with. I'm tired of thinking it's going to be helpful to guide people into wearing masks. I think we need to make it a criminal act when you don't. How many people have died now? 77? How many people will die in our city before it's over? I mean, and all of that could have been avoided by people simply wearing their masks. I may be the terrorist, but Cecil, we catch you without your mask, you're going to be the criminal. And I want to make that absolutely clear. I think we were negligent in not being more forceful in the beginning. It's insane to me that this many people could be dying and we're still having these discussions with these idiots. Anybody disagree?
I don't disagree, but a clarification, and we've talked about this before. I don't go out much now because of it, but I did go into Big Five the other day, and I walked in and I had forgot my mask because I don't go out. It's an accident. And that's not what we're talking about here, is those accidents and where people are warned or anything. It is the people that are just going out and saying the virus doesn't exist. So it's just a clarification on what we already know. And those people that, I mean, I hear it's a common thing that somebody just forgets. That's not what we're talking about here. We're talking about individuals that go out and blatantly, if they have it, they don't care. That's the problem. You're muted.
His name is Cecil Moss. If any of you are his neighbors, you might want to stay away from him. He's not going to be wearing his mask.
So, Mayor,
Go ahead, Ken.
Gary, you want to go first?
No, you can go ahead, Ken. Go ahead.
No, I mean, when we talk about science, although I kind of wish the County Board of Supervisors would pick up the phone and call Larry or Dr. Tron. I mean, if you hear what they say, they just got finished, their boots on the ground. And it's clear to me where the biggest issue of the breakdown, again, whether I'm not in public quite often, and I really don't see people not wearing masks. But what I wanted to segue back in, the two doctors just got finished saying that when they ask somebody, how do you think you got this, or where did you think you picked up COVID? You'll notice there's a common thread about what was said between the two doctors. Where I work at, we collect the same data information, and that's what's coming in from employees that get infected, is that they're at an event or a party and trusting of family or friends, and usually that's where they resort back to how or it got transmitted. So a real head scratcher. I get your frustration about we can't be over emphatic about wearing a mask and staying 6 feet away. I got that. That makes all common sense. But again, I think the real issues is those gatherings, and then predominantly that younger group, just by statistics, tell us that that's where it's being manifested from. My sense is that's where a lot of the contracting is taking place. So I get I concur with you. I get your frustration about the masks. But again, I know we can continue to beat that drum, but I'm dumbfounded because I really think that our problem is those group gatherings and predominantly friends and family, and I'm perplexed about how do you break that one? How do you break that down and get people to think through that? So anyway, just sharing.
It's not the Pirates Code. Remember that movie, Pirates of the Caribbean?
Yep.
It's more like a suggestion.
Yeah.
And that, quite frankly, is what public health said in the early days when, because I had the discussion with all of the mayors, we need to make this mandatory. And public health was saying, no, we need to encourage it. And now you see the results. And what I don't want our city to do is to make decisions based upon anything other than what supported by the research and the people most knowledgeable about this, which I would suggest to you is not Barbara Ferrer. But I guess the reason I'm so frustrated is Taiwan has 22 million people. LA County has 11. Taiwan had 7 people die. 7, not 700, not 7,000, 7. And they didn't close their restaurants and they didn't close their businesses, but everybody wore their mask and everybody knew to tell everybody to wear their mask. And I think we missed that opportunity very, very early into this. And I think we missed it because nobody was paying attention to the science. And, we were expecting LA County Public Health to have knowledgeable expertise. And then last week we learned they were just looking at the CDC website. I was incredibly, I felt betrayed. And I think that's why this motion is before the council. Did anyone from LA County Public Health want to speak to us? Do you know, Jason?
I'm not sure if anybody's on the line. You can start an item, but I doubt it.
So this has been reported on national news that we were going to do this today, and they have no comment. I mean, seriously, does anybody doubt the necessity of us breaking away with our own public health? I mean, they knew this discussion was going to take place, and they don't even send a representative. I think that it's abundantly clear to us, and it's, you know, in my counterpart in Palmdale, me and Mr. Hoffbauer rarely agree on anything, but we agree on this, that they could care less about us up here. Is there any other information we need on this motion?
I have a question that I want, and I don't want to shift from the mask, but Dr. Trong and Dr. Stock, how confident are you that, since we've always had issues getting certain things from the county up this way, how confident are you that we will get our fair share of the vaccine? Do we need to start taking preemptive steps now, or what? I mean, I know this is what we're trying to do now, but is there something we can do even before we form this? I'm a little nervous about that.
I know the county is not responsible for distributing the vaccine for the moment. It could be that Governor Newsom may change and allow the county to take over. But for now, it's Newsom's, it's at the governor's office that's distributing it, so.
My understanding is that Cedars-Sinai is going to be the hub in our region, and Antelope Valley Hospital has a freezer, an ultra cold freezer. I think hospitals have put in requisitions for so many doses, and then we'll see what we get back. I'm sure Kaiser Permanente has as well. So, you know, I think that's what's probably going on as far as the distribution of that. I just want to add in, I think the confusion about the masks is that a lot of what was going on was what you in the mask in public, you know, staying away from people and, you know, gathering, staying away 6 feet away from people. There was less discussion about what to do indoors, what to do in private. Who's your circle that you take your mask off with? How close is that circle? Meaning, is it just your spouse? Is it just your kids? Is it, you know, and how big is that circle? You know, what about your extended family? So I think that's where a lot of this, and I think now that we know that a lot of the transmission happens in family gatherings, friend gatherings, that it's obvious that when I go to visit my 80-year-old, my parents in their mid-80s, my mask is on, you know, virtually all the time. But you know, I spent a long time not wanting to hug them, and so I realized contact was not as big an issue. But you know, we take certain risks, and we also try and mitigate our risk. I don't take my mask off when I'm with them. I didn't eat Thanksgiving dinner with them. You know, we went over, we saw them. They ate, and then we went home and ate separately. So we got to be thinking all the time about what risk we want to take to protect ourselves and those we care about. That's my sort of main message here.
Yeah, I'm fighting it all the time. My baby son is 19, my oldest daughter is 22, and I have a 20 and 21-year-old. My daughter is literally going back and forth to LA. My son is training still for football, and we're constantly having this push and pull in our home. Where have you been? Who have you been around? Who's been around you? Can you account? I mean, it's amazing the conversations that I'm having with my own children every day, to the point that it almost gets tiresome, you know, talking to them when they leave the house. Be careful who you're around, keep your mask on. And so I understand we may be dealing with what everybody's saying, the fatigue of wearing it, the fatigue of doing it, but we have to really push it. And I think, Dr. Stock, we had a conversation about a little bit of it today with the community that I'm dealing with. Everything that you listed in that group, Dr. Trong, it's my people, you know, it's the group that I'm in. Up until recently, I had all of them: obesity, diabetes, and high blood pressure. And I'm still struggling with the blood pressure. It's coming back with a vengeance. So I understand. So we really have to get that message out as much as possible. Us that are in our 50s and 40s. I noticed you said 18 to 50. Is that the group? That seems like the parents that have college students, that kids are coming back and forth. That's what that seemed like. That seems like that group, my group, the 70 babies, who kids are going to college and coming home, and we're dealing with that group that's coming back and forth. My niece caught COVID. My son caught COVID at college. My niece caught it at college. And my sister-in-law and I are between 49 and 51. So we were very nervous in how to deal with that. And our mothers are in our late 70s. So, you know, I get the demographic. It makes sense to me, you know, what's going on. So,
You know, my wife and I, we have a rule. If we're not sleeping with the person, they got to wear a mask around us, and we got to wear our mask too. Makes it real easy to follow, I think.
Hope so.
my daughter still tries to cup and get into bed with us like she's an 8-year-old, and I have to kick her out the room. So I don't know if that'll work.
Well, I'm glad you kick her out.
Yes.
All right. Anybody want to say anything in defense of Barbara Ferrer? I mean, I want to be clear. What we're about to do may not have an effect on her, but it nonetheless is we've never had to do it to somebody before. You know, I mean, we're essentially saying a city with 150, 160,000 people have no confidence in the way you protected us, and that you failed to protect us. And it's very easy to not think that we're actually dealing with a human being that has feelings. And you know, I know that you guys have given this a lot of thought. I've given it a lot of thought. But I think without this expression of our contempt, and that's really what it is, nothing's about to change. And I want to be clear that for the reasoning of it, it's in my opinion, she failed, and she has refused to accept the fact that she failed. And so she's continuing to make the same mistakes that they made very early in the epidemic. Those mistakes were totally justifiable in the beginning because nobody knew what they were doing. It had been 100 years since we'd faced an epidemic like this. But then when they realized they made those mistakes, they just doubled down on them rather than admit them. And now they want to put more people out of business, and more people lose their homes, and more people being forced into homelessness, when we know that that has not worked. You know, it's forgivable that they might not have known that in the beginning, but they do know that now. And and then the level of communication that the public, I mean, our citizens pay that organization, that department, millions of dollars every year, and they don't have the decency to reach out to us, to try to work with us, to try to figure out, are we a little different than downtown? We have to do what they say because she has 3 votes. And that's all she has, is 3 votes. She loses one of those votes, she's probably not going to be there. 2 of the supervisors are as disgusted with her as I think we are. Supervisor Barger is supporting us in forming our own public health department. What does that tell us? I mean, what we're doing here is not something unknown to the government of LA County. But I do want everyone to recognize the gravity of what we're doing. But I also think that given the gravity of what's occurring because of that lack of leadership, and that lack of, I mean, at $1.2 billion, they could have the greatest minds of the nation working on this. Or they could have just called us and we could have lent them our COVID team. I mean, seriously, I mean, if you 3 had been working for LA County Public Health and they had listened to you, thousands of people would be alive today who are not. And you know, I'm eternally grateful for you for being there and for doing this. And you keep doing it day after day after day, and you don't ask for anything. And I mean, if there's heroes in our community, you certainly belong in that group. So I rarely make the motion, but I am making the motion this time that we vote, and I hope it's unanimous, that we have no confidence in LA County Public Health, and Barbara Friere. And we would request that LA County rectify this matter before more people die needlessly. Is that adequate a motion, Allison?
That is an adequate motion, yes.
Okay,
I'll second the motion.
Thank you. Before we vote, let's get public comment. And Andrea, if you could do that for us.
Okay. At this time, anyone wishing to comment on NB1, please press *9. I will announce the last 4 digits of your call-in number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please press *9 at this time if you wish to comment on NB1. Caller with the last 4 digits, 4618. Please state your name.
Good
Caller
evening.
with the last 4. Oh, go ahead. I'm sorry.
Yeah, good evening, Honorable Mayor and distinguished members of the City Council. My name is Luis Haro, and I would like to speak in support of setting, of setting the groundwork for our own local public health department. I'm increasingly concerned with the authority that LA County's public health director has to enact sweeping restrictions on our local businesses, particularly our restaurants, without having to justify those restrictions with the latest developments in science. I believe such broad authority to supersede the will of cities threatens the notion of local control and democratic accountability. If done correctly, I think a local public health department would greatly benefit the residents of Lancaster. My mom and sister, having worked in Antelope Valley Hospital's emergency room, including with Dr. Stock, can testify to the plethora of talented medical professionals who can staff and lead a local public health department. One concern that I do have is the potential cost for this potential department. A large price tag could potentially limit resources for other city projects and initiatives, such as loans for small businesses or creating our own hybrid police department. A joint powers agreement with Palmdale and Santa Clarita could help alleviate those costs. Before I conclude, I just want to make a quick plug for a worker recall ordinance that could help connect workers to the jobs they lost at the onset of the pandemic. Obviously, that's a discussion for another day, but I'd like to see that at a next regular meeting. I think it could really help stimulate the economy once the vaccine comes out. And just lastly, I want to express my deepest gratitude to our law enforcement officers, especially to our Valley's own Andy Ornelas, who recently passed away. My mom and my sister had the privilege of working with Andy as an ER tech at AB Hospital. Andy epitomized public service and dedicated his life to helping others. We join our community in praying for Andy's family, his friends, and all those who take the solemn oath to protect us and our family. Thank you so much. Have a good day.
Thank you. Anyone else?
If there is anyone else that would like to comment on NB1, please press *9. Okay, I don't see anyone else that wants to speak, but I do have one public comment that was emailed to me that I could read.
Okay.
It is from, I hope I'm pronouncing this correctly, Mirko Marone. It says, "Good morning, Mr. Mayor and council members. I am the owner of a hair salon in Lancaster. I would like, first of all, to thank you for the recovery loan program that allowed us to survive the past 2 shutdowns. Also, I applaud you for the decision to hold a special meeting tonight to explore the idea of having our own health department. Los Angeles is a big county and the entire Antelope Valley is not being treated fairly. Certain businesses like restaurants and personal care are being purposefully forced to close down without any scientific reason behind it. Thank you again, and I hope the entire council would approve this initiative."
Anything else?
No other comments at this time.
Okay, I'm starting a new plan. What I'm going to do is just take notes as people speak, wait for everybody to get done, and then address them. That way I'm not interrupting people, just so you wonder what I'm doing. I think I would have started that 12 years ago, but I'm a slow learner. I'm really proud of the council and the staff for what we are doing in regards to the restaurants. We will be announcing a program in the next few days, which will not only help put food in our citizens' homes or wherever they choose to eat it, but also will provide some relief to the restaurants. We're also looking at all kinds of different ways of easing the burden, either through Ken and Marvin have been working on a sanitation district waiver of fees. We're working on energy bill reductions. We've got all kinds of things in the hopper trying to alleviate the burden as much as we can. Because, for a lot of reasons, but one of those reasons is the quality of our city's well-being when the COVID is over. And I don't want to walk into a city when I take my mask off and walk down Lancaster Boulevard to vacant buildings. And that's the fight right now is trying to keep that from happening. But I don't want anybody to have any illusions that we're going to be able to get this public health department up and running in even 3 to 6 months. Palmdale is certainly on board, and that's really kind of something interesting that the two cities would do something like that together. And the restaurant relief stuff is really the idea of Marvin Christ. Once again, he's come to our I don't know how you dream this stuff up, but it's pretty good when you do. And we're also interested in any ideas that the community has as to what's feasible. I mean, we don't have this bottomless pit of money. Could you imagine me with the printing press for money? It'd be scary. So they don't give me that ability. But with the resources that we do have, we're using them to keep as many of you viable as we can. But we're all open to more ideas in regards to do that. So could you call the roll on the vote?
City Council Member Doris?
Yes.
Molly?
Yes.
Mann?
Yes.
Vice Mayor Chris?
Yes.
Mayor Paris?
Yes. Passes unanimously. So let's move on to the next item, which I foolishly took off the computer. Allison, could you just announce?
Yes, we're on NB2, and the item is to direct staff to begin the process of gathering documentation and list of resources necessary to start a public health department.
Anybody have a need for further discussion or report on this, or have we covered it on the first item?
We need is there public comment on this?
Yeah, I mean, I'll get to that, but I want to know. Okay, I guess we have to do the report, and if there is public comment, right? Just do the report, Jason.
You can waive the staff report even if there's public comment.
Oh, okay. Let's waive the staff report then. I think we covered it, more than adequately. Is there any other further public comment?
At this time, anyone wishing to comment on NB2, please press *9. I will announce the last 4 digits of your call-in number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please press *9 at this time if you wish to comment on NB2. No comments at this time.
Motion to approve NB2.
Is there a second?
I will second that. Ken Mann.
Andrea, if you would call the roll, please.
City Council Member Doris?
Yes.
Molly?
Yes.
Mann?
Yes.
Vice Mayor Chris?
Yes.
Mayor Paris?
Yes. Passes unanimously. In conclusion tonight, I would like to once again, we have every single one of us in this city have to get aggressive in reminding people that mask has to stay on. And if you have children and they come home, you are at extreme risk more now than ever. You have to take precautions inside the house. You have to educate your kids. You cannot take that mask off. Right now, today, 11% of the population in Los Angeles County is infected with COVID-19. 11%. The replication rate is for every person infected without preventative measures will infect at least 2.5 people. Do the math. This thing is going to get a lot worse before it gets better. And all you have to do is make absolutely certain distancing and masks apply to everybody around you. 2 days ago, I'm down at at Cedars-Sinai at seeing the doctor, and I got on the elevator, and there was one other person, because you put 2 people on the elevator, you can stay 6 feet apart. And when somebody tried to get on, I just wasn't having it. I mean, I've just decided that I've got to get proactive about it, and you have to be proactive about it. I mean, I wouldn't let somebody else on that elevator, and they knew, and it was very clear to them, they didn't want to get on that elevator. We have to enforce that around everybody around us. And the more vigilant and the more aggressive we get in that, the safer we're going to be. So I encourage you to do that. Now,
Rex,
yeah.
was it Carol?
No, but she had a similar experience. These people were fighting about it. Somebody wanted to get on the elevator. And so she goes, "How far are you going?" 1 floor. "Okay, shut up. You shut up." They went, these are people she didn't know. And the reason she was telling them to shut up, it's because of the breathing. Okay, I think enough said. We're going to get through this. We're going to be stronger when we do. We're going to be a healthier community when it's over, because look at what we're learning. I mean, I don't see a flu epidemic for another 50 years. You know?
Mayor Parrish, before we adjourn, we do need to do public comment on non-agendized items.
Okay, is there public comment on non-agendized items?
At this time, anyone wishing to comment on non-agendized items, please press *9. I will announce the last 4 of your call-in number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. State law prohibits council from taking action on items not listed on the agenda. Please press *9 at this time if you wish to comment on non-agendized items. No comments at this time.
Okay, thank you. You know, the one last thing I want to leave you with is the reason we want our own public health goes beyond COVID. You know, public health is responsible for your drug treatment issues, your needle exchanges if you have them, your STD prevention programs. I mean, it's a plethora of programs that if we had local control of, we could target those funds to areas where we need them. If you do it on a countywide basis, it makes little sense for outlying areas. I'm really kind of excited about this because what I see for the first time is an ability for the city to actually raise up the health and welfare of the city. You know, we don't need to be have the worst health in LA County. We don't need to have the worst mortality for preventable diseases. We can have a huge impact. This is an exciting time, and it really should be an exciting time for the healthcare professionals because as you can see, we don't hesitate to bring citizens in and bring people who are knowledgeable in to help us with this. So, you know, it's, you know, it's kind of a Debbie Downer situation as to why we have to do it. But the benefits of us doing it, I think all three cities are seeing that this has enormous potential. And I mean, I think all of us realize the healthier the city, the happier the city, the less crime in the city. You know? So this is a good thing, folks. Thank you.
Yes.
God bless. I love all of you.
Rex, before you adjourn, can we adjourn in the name of Andy Ornelas, the CHP officer that lost his life?
Yes, yes. And we will also be doing some things next week. I mean, I can understand the kids coming in the room, but flushing the toilet? I don't know how many times that's happened to me today. But back to Andy, we're going to do something to honor his sacrifice. You know, it's a day of great sadness, and we are closing the meeting in honor of him. And we will be doing a few other things. Anybody else? Would you announce when the next meeting is, Allison?
Next meeting is December the 8th at 5 p.m.
Thank you. Thank you, guys. Have a great weekend.
Good night.
Night.
Night, everyone.